My name is Ashley Dado, and I'm a junior at Mid-American Nazarene. I was 10 years old when I was first diagnosed with a medulloblastoma. It is a malignant brain tumor, and it's most common in children and young adults. The plug over here, it was scary. I really felt like this could never happen to me because we had no diagnosis in my family of cancer. And so it was really scary, and none of us knew what was going on.
You never expect having a young girl to have that kind of news.
I cried a lot. To me, I felt like I was dying. So it was a very sad time for me. I didn't know what was going on.
She did everything she could to just try to be the Ashley that she knew, but that person was pretty much almost gone. You know, she was fighting for her life. We knew that, and she was just trying to do her best to do that. She developed a routine. She developed her own little schedule. She would get home from treatments in the afternoon and kind of sleep it off, and then she would plow through her homework to the point where she got ahead in school.
It changed my life a lot. My friends, they didn't know what was going on, so that kind of scared them. They kind of pushed back. And going through treatments was really scary because it caused a lot of side effects, like losing my hair and just making me sick and not feel very good. Well, due to the treatments and cancer, I have a lot of what they call late effects. And then my schoolwork and everything is different because of those late effects. So, like I can't do scantrons. I have a problem with hand-eye coordination. And my school allows me to take more time on tests so I can concentrate harder.
So late effects are health problems that can show up in survivors. Some of them actually show up, during treatment or right after, and those health problems continue into adulthood, like the endocrine problems that come up. But other late effects that can show up 10, 20 years after therapy include heart problems, lung problems, kidney problems, another form of cancer, and as we talked about, the emotional aspect of it, and the learning problems that can come up.
It's really important to me and, of course, many other cancer survivors that we have somebody who's there to transition us into adult care, and then that way they'll be able to have like our medical records and know our needs, and our former and current doctors to be able to talk back and forth.
Megan? Hi, Megan. The transition clinic is really important because here at Children's Mercy, they've been here with our physicians and our organization for some patients for just a couple of years, for other patients for 10, 20 years. And so it's a little scary to leave and go out into the adult world because they're so used to being here at Children's Mercy. And this transition clinic really helps the survivors to have a place to go, but it also really helps relieve the stress and anxiety of parents as they're nervous leaving Children's Mercy Hospital.
When they first told me I was going to transition to, KU Med, I was just nervous that at first they wouldn't know all my needs and things like that, but I'm glad now that that was explained to me and that they'll be there to take care of me just like people at Children's Mercy.